Hello world, I welcome you to our session today. We shall be talking on varicocele. Varicocele. Okay, varicocele is the enlargement or the dilation of the veins of the testicles, the veins of the scrotum. Okay, the scrotum is actually supplied by blood from the arteries, and then the veins drain the deoxygenated blood from the testicles. Deoxygenated blood is the blood that does not have enough oxygen. You might want to call those ones as the bad blood. All right, so for the deoxygenated blood to be taken away from the testicles, the veins do that function. And these veins are designed in such a way that they have valves. The valves make it in such a way that blood flows only in one direction. For one reason or the other, the veins will begin to have these valves compromised so that the valves do not control the flow of the blood again, and then the blood begins to pool in the vein. And by the pooling of this blood in the vein, they begin to dilate, begin to expand in diameter. All right, the pooling or the dilation of the veins of the testicles or the pampiniform plexus is what we call varicocele. And so of what importance is the idea of knowing varicocele. All right, the male testicles actually operate at a temperature that is lower than the temperature of the human body inside. That is why your bag, the testicles, are hanging outside instead of lying within your abdominal cavity. All right, because the temperature in the abdominal cavity is higher and the testicles there cannot survive well. The sperm production will not be perfect and in good state if it's to be done inside. That is why the testicles are hanging at a place that has a lower temperature. By the engorgement or the enlargement of the vein of the testicle, it increases the temperature of the testicles, and by the increase in the temperature of the testicles outside what should be the ideal temperature, these affects the way the sperms are produced, and that can result in low sperm count. So for men, low sperm count is usually a major cause of infertility, and in some men who have varicocele, you discover that a lot of them will likely have infertility. And so that is why it is important that if one begins to suspect the likelihood of varicocele, sonographic examination of the testicles or ultrasound scan of the testicle is one basic medical imaging modality that is used to assess for the presence of varicocele. All right, with ultrasound scan, it will be possible to assess the testicles, to check out for the dilated veins if there are any, to as well check out for the testicles if there is any change in the size, if there is any inflammatory process, if there is any enlargement in the epididymis or any growth or mass in the testicles or epididymis. Though the urologist will likely have a physical examination done to assess to see if the worm-like structure on the skin of your testicles are there, which are the varicocele. Another good way by which you can find out if there is varicocele is by a radiological investigation known as the scrotal ultrasound scan, or what we call testicular scan. All right, with testicular scan, it will be possible for you to know if you have the varicocele or the veins of the testicles or the scrotum dilated. You might have to book appointment to have an ultrasound scan of your testicles done. All right, keep sharing this so that people will get to know more about some of this medical information. I remain your very good friend. Of course, I'm your friend, Onyebuchim Titus Diwoke, on this special edition of your beautiful program. Do you know? If there be any topic of interest that you would like us to discuss, just drop it in the comment section. We'd like to have your reactions. We'd like to have your comments, your reactions to what we have been sharing, to see how best this gets to you.